Every night after 50, millions of people lie down hoping for rest, and instead their legs start to ache, throb, or feel strangely restless. Not during the day, not while walking, but the moment they finally relax. If that sounds familiar, this video is for you. And here's the part most people don't realize: this is not just aging, and if you keep ignoring it, it can quietly get worse over time. What if I told you your leg pain at night is often a signal, not of damage, but of something your body is struggling to manage while you sleep? Stick with me, because one of the reasons I'll explain in a minute surprises almost every patient I see. Quick favor before we go deeper: if you like simple, science-backed health explanations like this, tap like and subscribe. It helps more people find this kind of content. Now let's talk about what's really going on, because this is where most people misunderstand their body. Most people assume leg pain is about muscles getting older or weaker. That's part of it, sure, but it's not the full story. In fact, for many people, the real cause has nothing to do with how strong your legs are. It has to do with what happens when you stop moving. Think about your day: you're upright, walking, sitting, standing. Your blood is constantly moving downward because of gravity. Your muscles are quietly helping pump it back up. But then you lie down, and suddenly everything shifts. Fluid, blood, and pressure redistribute in your body, and if your system isn't working smoothly, that's when the discomfort shows up. Have you noticed your legs feel heavier or tighter at night compared to the morning? That's not random. Wait, think about that for a second. It's your body trying to tell you something isn't working properly. Let me show you the first major reason this happens. Before starting, tell me your age and country in the comments. Reason number 1 is something called venous pooling. Sounds technical, but it's actually very simple. Your veins are like one-way roads carrying blood back to your heart. Inside them are tiny valves that keep everything moving upward. When you're younger, these valves work perfectly, like doors that never fail. They open, close, and keep blood flowing smoothly. But after 40, and especially after 50, something changes. Not suddenly, not dramatically, but slowly, quietly. Those valves start to weaken. And this is where it gets interesting. Because once that happens, blood doesn't move as efficiently anymore. So what happens next? It starts to collect or pool in your lower legs during the day. Now here's the tricky part. You might not even notice it. Maybe your socks leave a mark. Maybe your ankles look a little swollen in the evening. Nothing that feels serious. But here's what most people miss. The real effect doesn't show up during the day. It shows up at night. When you lie down, that pooled blood suddenly begins to shift back into circulation. And that change, that pressure shift, that's what triggers the aching, the throbbing, that deep, heavy discomfort that won't let you rest. Almost like your legs are trying to tell you something isn't flowing right. Think about that for a second. A study in the Journal of Vascular Surgery found that chronic venous insufficiency affects up to 40% of adults over 50. And one of the earliest signs: nighttime leg discomfort. So if you've been blaming your mattress or your shoes, you might be looking in the wrong place. Let me ask you something. Do your legs feel better when you elevate them, even slightly? If yes, that's not random. That's a clue. And this is where people get it wrong. They treat the pain but ignore the circulation problem behind it. Now, before we move to the second reason, there's something important you need to understand. Not all leg pain at night is the same. Some people feel a dull ache. Others feel burning. And some feel something even stranger: a constant urge to move their legs. And that's where the next reason changes everything. And that brings us to reason number 2, and this one is often misdiagnosed. It's called Restless Legs Syndrome, or RLS. You may have heard of it, but most people misunderstand it. This isn't just fidgeting or being uncomfortable. It's a neurological condition. And it tends to show up exactly when you're trying to relax. You lie down, you're finally still, and suddenly your legs feel like they can't stay still. You feel this crawling, tingling, or pulling sensation. And the only thing that helps is moving. Walking, stretching, shaking your legs. The moment you stop, it comes back. Sound familiar? Here where science gets interesting. RLS is strongly linked to dopamine, a chemical in your brain that helps control movement. Research published in the Lancet Neurology shows that disruptions in dopamine signaling are a key factor in restless legs. And here's the twist: dopamine levels naturally drop in the evening, so symptoms get worse at night. That's why during the day, you might feel completely fine. And at night, it's a different story. There's also a strong link between RLS and low iron levels, even if your standard blood tests look normal. Your brain may still not be getting enough usable iron. And without it, dopamine production struggles. So your legs react. Let me ask you this: when your legs feel uncomfortable at night, does moving them give temporary relief? If yes, that's not random, that's a pattern. And patterns matter. Now, here's something most people do that actually makes this worse. They ignore it. They assume it's just part of getting older. Or they try to push through it. But the longer it goes unaddressed, the more it can affect your sleep. And once sleep starts breaking down, everything else follows. Energy, mood, memory, even heart health. We'll come back to that in a bit because it's more connected than people think. But first, let's move to reason number 3. And this one is incredibly common, but almost never explained clearly. It's nighttime inflammation. Now, before you tune out thinking inflammation is just another buzzword, let me make this simple. Inflammation is your body's repair system. It's how your body heals small wear and tear. But here's the catch. Your body does most of its repair work at night. When you're resting, that's when blood flow increases to certain tissues and healing processes ramp up. Which sounds good, right? It is, unless there's too much inflammation to begin with. Conditions like arthritis, past injuries, or even long-term strain can create low-level inflammation in your joints and muscles. During the day, movement and distraction keep it in the background. But at night, there's nothing to mask it. And as circulation changes, that inflammation becomes more noticeable. Almost like turning off the lights and suddenly hearing every little sound in the room. A review in Nature Reviews Rheumatology highlights how inflammatory markers can follow a circadian rhythm, often increasing at night, which is why symptoms like joint stiffness and pain feel worse in the evening or early morning. So if your legs ache more when you finally lie down, your body might not be breaking down. It might actually be trying to repair, but doing it inefficiently. Now here's a simple question: do you wake up with stiffness, especially in your legs or knees? That detail matters more than you think, because it helps us narrow down what's really driving your symptoms. And we're just getting started. So let's pick up right where we left off. We've talked about circulation changes, restless legs, and nighttime inflammation. Now we get into reason number 4, and this one surprises people the most. Because the problem isn't actually in your legs. It's in your nerves. This is called peripheral nerve sensitivity, or in some cases, neuropathy. Now don't let the word scare you, I'm going to keep this very simple. Your nerves are like electrical wires, they carry signals between your brain and your body. Touch, temperature, pain, all of it travels through these pathways. Over time, especially after 50, these nerves can become more sensitive or slightly damaged. Common causes include diabetes, vitamin deficiencies, especially B12, long-term sitting, or even just age-related wear. But here are the key points. When your body is busy during the day, your brain filters out a lot of these signals. You're walking, talking, thinking, there's noise in the system. At night, everything gets quiet. And suddenly, those nerve signals become much more noticeable. That's why some people describe their leg pain as burning, tingling, or even like pins and needles. Not sharp pain, not muscle soreness. Something different. A study in diabetes care shows that peripheral neuropathy affects up to 50% of people with long-standing diabetes, and symptoms are often worse at night due to reduced distractions and changes in nerve signaling. Even people without diabetes can experience milder forms of this. Let me ask you something. Do your legs ever feel like they're buzzing or slightly electric, especially when you're lying still? That's a clue. And here where people often go wrong. They massage harder, they stretch more aggressively, they assume it's a muscle issue. But if the root is nerve-related, that approach won't fully solve it. You have to calm the signal, not fight the muscle. We'll talk about how to do that in a bit. But first, there's one more reason we need to cover. And this one ties everything together. Reason number 5 is something called electrolyte imbalance. Now I know that sounds like something athletes worry about. But it's actually very common in older adults. Your muscles rely on minerals like magnesium, potassium, and calcium to contract and relax properly. Think of these minerals like tiny switches. They tell your muscles when to tighten and when to release. If those switches don't work properly, your muscles can cramp, twitch, or ache. And here's the important part. These imbalances often show up at night. Why? Because during the day, you're constantly adjusting, drinking water, eating, moving. At night, your body is in a more stable state. So any imbalance becomes more obvious. Research published in the American Journal of Medicine has linked low magnesium levels to increased muscle cramps and nighttime discomfort, especially in older adults. And it doesn't take a severe deficiency. Even mild imbalances can create symptoms. Now think about this. Have you ever woken up with a sudden calf cramp? The kind that makes you sit up instantly. That's not random. That's your muscles misfiring. And dehydration makes it worse. So if you're drinking less water in the evening to avoid waking up at night, you might actually be making your leg discomfort worse. See how this all connects? Now, before we go into what actually helps, let me pause for a second. Out of these 5 reasons, which one sounds most like what you're experiencing? Is it heaviness, restlessness, burning, stiffness, or cramping? Drop it in the comments. I read them and it helps me understand what people are dealing with most. And if this is already making things clearer for you, hit the like button. It tells me you want more videos like this. Now here's the part most videos rush through, but this is what actually matters. What can you do about it? Let's keep this practical. No complicated routines, no extreme changes. Just simple adjustments that work with your body, not against it. First, elevation. This is one of the easiest and most effective things you can do. About an hour before bed, lie down and elevate your legs slightly above heart level for 10 to 15 minutes. Think of it like draining fluid from a sponge. You're helping your circulation reset before sleep. If venous pooling is part of your issue, this alone can make a noticeable difference. Second, gentle movement, not intense stretching. A short walk in the evening or even light ankle movements while sitting helps keep blood flowing. Avoid aggressive stretching right before bed. That can sometimes irritate already sensitive tissues. Third, check your hydration and minerals. You don't need to overdo it. But make sure you're getting enough magnesium and potassium through food. Leafy greens, nuts, seeds, bananas, simple stuff. And don't completely cut fluids at night, just balance it. Fourth, create a wind-down routine for your nervous system. This is especially important if your symptoms feel restless or nerve-related. Dim the lights, reduce screen time, give your brain a signal that it's time to slow down. Because your nervous system doesn't just affect your mind, it affects your body too. And finally, pay attention to patterns. Your body leaves clues. When it happens, how it feels, what makes it better. Those details matter more than you think. Because once you understand the pattern, you can actually change it. Now here's the bigger picture. Leg pain at night is common after 50. But common does not mean normal. Your body is communicating with you. Not in words, but in sensations. And when you understand what it's saying, things start to make sense. And more importantly, they start to improve. If you found this helpful, subscribe to the channel. I break down complex health topics into simple, practical ideas you can actually use. And share this with someone who complains about leg pain at night because chances are they've been told to just live with it. They don't have to. I'll see you in the next one.